Thank you, Adebola, for that update. Nigeria's 43 cabinet ministers have donated 50% of their March 2020 salaries to support the federal government's effort to combat the COVID-19 pandemic. Trade and Investment NTA Adebayo met with the Manufacturers Association of Nigeria in the provision of requisite facilities and supplies for the prevention of COVID-19 in line with extant guidelines. The minister advised the association not to shut down production activities but scale up in the manufacturing of essential commodities such as pharmaceuticals, consumables, sanitary and hygiene products needed to curtail the spread of COVID-19. The meeting commended the measures taken by the Bank of Nigeria
state, and as directed by the federal government, the border is completely shut down, and according to immigration officials, even the push pass used by the nationals of the two countries have been closed. This is coming at no better time than now, as NTA News observed that there was no port health service personnel at the border port. Meanwhile, markets and motor parks in Kebbi State have continued to open for businesses in all parts of the state. However, some passengers and commercial vehicle operators appeal to Kebbi State government to provide other precautionary measures to the motor parks.
In case anyone will sneeze or anything, so I took my hand sanitizer along with me. I was not given anything by anybody.
I think it's necessary.
Rapid Response Unit in the event of total lockdown in Nigeria. This is to cater for the people with food items and other support as they remain indoors. Director General of NEMA, Mustafa Mehaja, has said the Rapid Response Unit is expected to be replicated in all states of the Federation. Ilyasu Ali Yakubu has that report.
Members of the Rapid Response Team were drawn from the Nigerian military, Ministry for Humanitarian Affairs and Disaster Management, National Center for Disease Control, the Federal Fire Service, Federal Road Safety Corps, Nigerian Police.
Accident. It is not a military explosion. It was an accidental discharge of explosive materials that were being conveyed from Ibadan to Edo State for a quarry company.
Unconfirmed report says the vehicle carrying the explosive is buried in the huge crater created by the explosion. As a result of this, traffic along Akure-Owo Highway, which is a major gateway to the north, has been disrupted. The major concern for the governor, who has also visited the scene of the blast with the state deputy governor, is the huge number of people trooping to the scene of the accident, especially at this time of the coronavirus pandemic.
Is on the containment of coronavirus in Nigeria, and our guest today is the Minister of Health, Dr. Osage Ihanere, who will be back very shortly. And we thank you for staying with us on the program tonight. And our guest tonight, as we have earlier told you, is the Minister of Health, Dr. Osage Ihanere. Good evening and welcome to the program.
Good evening.
All right, before we get started, let's take this report. The Federal Capital Territory is among states with recorded cases of COVID-19 in Nigeria. How are the authorities responding to emergencies? Hakeem Aliyu tells us the measures in place.
Nigeria is among African countries affected by the novel coronavirus disease, COVID-19, with figures rising. Before now, perceptions over the readiness of the authorities to effectively contain the outbreak of COVID-19 was a thing of heated debate, as many felt a lot more needed to be put in place. In the Federal Capital Territory, there are 2 isolation centers located at the University of Abuja Teaching Hospital, Gwagwalada, one already in use with 25 bed capacity, while the other is under construction.
You know, the national protocol is until you confirm, you don't take for treatment center. There is self-isolation, quarantine yourself by yourself. If you develop symptoms, you invite us, we come and take samples, then test it. If you're positive, then we take you to isolation stroke treatment center.
Some facilities in the territory have also recently been converted to isolation centers.
In the next 1 week or few days, it will come on board. He identified Zuba Hospital, Karu Hospital. We are working on them.
The authorities noted that basic equipment for patient medical personnel are being worked out to meet the needs for the effective management of COVID-19 pandemic. Many are of the opinion that critical to this fight is a more sophisticated and practical steps in contact tracing, emergency evacuation, and training.
Right now, Honorable Minister, you can see that the numbers are growing by the day. The numbers of tested and confirmed cases are growing, and we've been trying to avoid, community, infection, which would be very, very dangerous, for us as a nation, knowing the way we live our lives. We live in groups, we have several meetings and what have you. Now, what are the long or short-term measures being put in place, to ensure that we don't allow it, to enter the hinterland?
Very good. That's a very good question, and that is why we have been campaigning for the social distancing. So
pick my call. Then bomb me where? Mommy of life. Final, mommy. Where my car? Mommy, now small things remain. If my car not ready for tomorrow, me and you go put leg inside one trouser. One lie. Lost my phone. Yes, ma. Yes, ma. Yes, ma. Not got this phone, no. All right, yes, ma. Hey, Majekini. Mommy, no be you. Don't waste your credit. When I finish, I go call. You call me. Me when my middle name na credit. Where Glow they give me boku.
Glow and Mebo get 5 times your recharge to call all networks.
Results with respect to stemming the tide of coronavirus in that country. What other measures do you think we can take to ensure that we do not have the experience of China or Italy?
Well, the first and the most important measure is to be fast and I will say aggressive in our case finding and in our testing, so that we reduce the risks, reduce the number of patients who are needing any kind of treatment. Now, the other measure are social measures, social distancing, as I've said, and reducing the congregations, gathering of people, and also the movement of people. There are countries like China who did carry out a very successful lockdown, because the lockdown means that they succeeded in interrupting the transmission. At the end of the day, every country has to adapt that method to their own peculiarities, to their own circumstances. And in Nigeria, we have been working out ways of doing that. We are working with NEMA, we are working with other humanitarian and civil organizations that will probably be on hand if there are needs that arise, even if we didn't lock down. So whether we lock down or not, we are preparing for the eventuality.
Let's now join George for Sports Update.
The increasing numbers of those who are infected by the coronavirus in Lagos, the state has erected a temporary isolation center at the renovated Onikon Stadium to increase the capacity to isolate the affected ones. The State Commissioner for Health, who stated this while briefing the media on COVID-19 in Lagos, explained the rationale behind the decision.
Onikon Stadium is a very suitable place to erect a temporary structure because the stadium in itself provides